Hi there from the AAFE Training Center. I am Jill, and today we are treating our patient with neurotoxin. So if you want to come in and take a look, I'm going to go ahead and mark her. We're going to be treating horizontal forehead lines, the 11s, and the crow's feet. I've already prepped her face. I've wiped off all of her makeup. She's been cleansed as well. And so she's all ready to go. One thing I want to point out, when you're evaluating somebody for neurotoxin, there's a couple of considerations you must always think about when you're deciding on a dose. So when we look straight at Denise, you can see how deep set her eyes are. So patients with a deeper set eye have less of a risk of brow ptosis. Your shallow set eyes or your patients with hooding are at greater risk for dropping those eyebrows, giving them a brow ptosis, compromising the positioning of the brow. But when they have that deep set eye, it almost acts like a little bit of a shelf, so it can't really affect that brow as much. In addition, she has a fairly tall forehead, so that's an indication that she can handle a little bit more Botox than somebody who, say, has like a very teeny tiny forehead. Raise your eyebrows for us. See, look at how thick her frontalis is as well. When she activates this muscle, you can appreciate how thick it is. So that's something I'm also taking into consideration. And then lastly, the degree of the creasing that she has. So you can see she does have pretty mild, but she has static creasing across that forehead. So all of these things I'm taking into consideration before I'm determining what an appropriate dose for her would be. So raise your eyebrows for us. It's important that you're always identifying the lateral border of the frontalis. So what that means is, where does the frontalis end? Relax and raise again so they can see. Good. So you can see here her frontalis is moving all the way out. And the reason that that's important is, if I only treated her to like mid-pupillary here to here, these muscle fibers will remain active. And so what's going to happen is she's going to start compensating with these muscles. So this area will be put to sleep and these areas will fire. So look how crazy that would look if she continued to crease laterally and then pulled this eyebrow. That's what we refer to as that Spock eyebrow. And that is a result of leaving some of the muscle fibers active. They sort of go into overdrive and want to pull up. So I like to give myself that visual of my frontalis is this wide, and I want to make sure that I place my injection sites about nickel to dime size apart. So that way we have nice even distribution of product across the entire muscle. Raise your eyebrows for us. So now I go along and I basically just have them raise and lower a couple of times, raise, and I'm looking for creasing of the skin. The creasing of the skin is a result of the muscle contraction underneath. So rather than chasing this wrinkle here, I know that if I put the frontalis to sleep, these wrinkles will resolve on their own. Just once the muscle can't move, the skin over top won't move either. So you can see here I've spaced out her injection sites about nickel to dime size apart. She's going to get really nice diffusion of product. In my opinion, I think this sort of leads to the most natural looking results when we just sort of treat the frontalis as a whole rather than aiming particular doses in certain sites. Make an angry look for us. So you can see really nice here the tails of her corrugators. Relax, and then again. So that means this tail of her corrugator is the lateral end where it becomes superficial, relax, and inserts into the tissue. We don't want to treat beyond that lateral corrugator because that's actually no longer the corrugator. We're now sort of getting into that frontalis, which is definitely going to give you that dropped eyebrow. So I always like to give myself a little marking of lateral corrugators, the tail of the corrugator, so I know not to treat beyond that point. And then I'm just sort of spacing my injections evenly throughout those corrugators, which are here. Okay, now we're gonna mark her crow's feet. Just turn this way for me. You can see she has a couple of vessels here. We will do our best to try and avoid those. This is a pretty vascular area. When you're consulting with your patients, always making them aware that there is a chance they can bruise, because sometimes there are vessels we cannot see. So we'll do our best to avoid the ones that we can see. I like to palpate her orbital rim, and then my injection sites should be about 1 centimeter from that orbital rim. Can you smile for me, cheesy? Good. Relax. Cheesy. Relax. And then this side. So same thing, palpating the orbital rim. Cheesy smile. Relax. And so I've just sort of spaced my injection points there as well. And we'll get ready to inject here in a moment. All right, we are going to go ahead and start our treatment here. Again, she has a pretty tall forehead, she has deep set eyes, so we are using a little bit of a higher dose on this patient than I would use in somebody who has shallow set eyes. In this case, we are using Botox for our botulinum toxin. And you can see I have a couple X's marked here. She has pretty heavy activity in that center section, so I'm giving her a little bit more of a dose in that center section, so that's why I have those X's marked. Doing okay?
Mm-hmm.
Turn towards me, please. Okay, so we're all done with our frontalis. When I'm wiping my dots away, always wipe up and away. This is going to prevent moving that product down. That's the last thing we want to do to move it any closer to the eyebrow. So we always wipe up and away. When we're treating the procerus, you can see truly like how thick this muscle is. So I always like to go full depth there just to make sure we treat all of the muscle fibers of the procerus. And then it's really important that we're using good injection technique in the corrugators. The reason I'm using this sort of 2-finger hold is I'm using my pointer finger here to block the orbital rim to prevent product from migrating down to the levator palpebrae superioris. This is the muscle that's responsible for keeping our eyelids open. And so when you have product migrate down to that muscle, you can develop lid ptosis, which is ptosis of the eyelid. And we want to avoid that at all costs. So again, you can see when I'm on this side, I'm using my thumb to block that orbit, and I'm watching my depth. We don't want to be too deep here. If you're too deep in this area, you could hit the frontalis. And if we're treating the frontalis this low, you're definitely increasing the chances of developing eyebrow ptosis, which is, again, compromising that positioning of the eyebrows. Turn towards me a little bit. Treating the crow's feet, we always inject away from the eye. We don't want to affect those extraocular eye muscles. And I'm, again, trying to avoid these little tiny vessels that I see just to try and spare her from bruising if we can. Knowing your anatomy is incredibly important. When you're treating the crow's feet, we also have our smile muscles are pretty close to here. The zygomaticus major minor are the muscles that attach to the corners of our mouth and pull our lips up into a smile. So if we accidentally have product migrate down to those muscles, we could jeopardize our smile. Of course, that would only be temporary. We metabolize that neurotoxin out about 3 months time, but the patient would be stuck with that for 3 months. So having a really, really good understanding of the anatomy and proper injection technique is going to deliver the best results and give you the greatest chance of avoiding any potential for complications. So that's all we have for today. Again, I'm going to wipe off all of her dots, keeping in mind I'm wiping up and away from that eyebrow. I don't want to move the product from her crow's feet downwards because that's going to increase targeting those smile muscles that I definitely am not wanting to affect. So thanks for watching.